Hi, everyone. Welcome to the Region 1 of the Network of the National Library of Medicine. Today, we'll share a little bit about what Region 1 has been up to and get some insights from the work that you are interested in as well. To help you along, I'm going to share some resources in advance so that you are welcome to download them and follow along. I will say that if you download the presentation slides now, they are out of order because I was tinkering around with the slides probably about an hour before we even started here. But hopefully you can take note of some of the resources that I provided for you, including the presentation. There's a handout with all of the links that we are sharing today at this hour, as well as our annual report that we've created too. So please take a moment to download those. And if you have any questions for us, please send me an email, or if you'd like to schedule time for a consultation, please connect with me via my Calendly link that I provided on this slide as well. So just as mentioned earlier in Martha Meacham's presentation, the NNLM Regional Medical Libraries, there are 7 of them across the United States, and we all work collaboratively to help with both regional and national programming as well. So if you see something that's happening, say in Region 5, for instance, and you should be able to sign up for it and participate just as much as anyone from any of the other regions will be able to participate in some of the offerings that we have available as well. Including with collaborating with all of the regional medical libraries, we do collaborate with all of the NNLM offices and centers as well. So there are 3 offices and 4 centers, and we all coordinate with the Office of Engagement and Training out of the National Library of Medicine in Bethesda. As a quick little reminder, the NNLM Region 1 has 8 different states and 1 territory that we try and do support with and try and find out some of the programming and engagement ideas that you would like to put forth. Our team leads include me as the Executive Director and MJ Tui as the Associate Vice Provost, the Dean of the Health Sciences and Human Services Library and Director of the NNLM Region 1 program, as well as Director of the NNLM Web Services Office. Included in our staff is Colette Boyu, who serves as our office manager. Nancy Patterson is our outreach librarian focused on member engagement and supporting those who receive funding from us. And then April serves as our outreach librarian who will work on programming tied to environmental determinants of health, social justice, and health equity issues. We've added in the last few months 3 new staff members, actually. Tiffany will serve as our health literacy librarian. Christine works as our data management librarian, and Faith is our outreach and education librarian. So as you may have heard, the NNLM has agreed upon 3 specific initiatives. In our collaboration, we'll try and work on these 3 particular initiatives over the next 4 years. Confronting health misinformation, it's related to engaging with communities to help raise awareness of trusted and high quality and relevant information, develop strategies to improve health literacy, data literacy, and understand and actively engage in medical research. Bridging the digital divide is focused on promoting technology and digital equity, digital literacy, and telehealth through long-term partnerships and collaborations. So it's to hopefully bring in online health information to communities across the United States. And then the final one, environmental determinants health, has a wide range of different topics, and they include socioeconomic factors, natural and built environmental factors, pollution, climate change, disaster information management, mental and emotional health, rural and urban health, tribal health, access to healthcare, health advocacy, and sustainability. As mentioned in the previous presentation Martha provided, the National Library of Medicine often asks the NNLM to focus and consider to supporting and provide programming on topics of high interest that is not just something that NLM identifies, but the National Institutes of Health identifies as well. Some of the past topics that we've worked on include maternal health, smoking cessation, germ science, HIV/AIDS outreach, and at the moment, we're looking at these 3 priority areas at the current moment, but it may fluctuate as time progresses. The first one is the All of Us Research Program, which is a large-scale clinical trial to get 1 million people to participate so that they can have new advances in medical research and in science. Another topic area is the librarian's roles in data sharing and research literacy. And then finally, community participatory research. So I'm going to put a little stop here and ask the audience who took the time to come join us, if you were presented these initiatives in priority areas, what would you do? So I've listed all 6 of the ones that I've identified earlier, and I know that some ideas were shared in Martha's presentation, but if you were presented these different interest areas or priority areas, if there's one that really speaks to you, and I see that Jeff has mentioned health misinformation, what kind of programming or activities do you think would be great to do if you were wanting to focus on health misinformation? So let me know program ideas, activities that you would like to do, or programs that you would like to do if given an opportunity to do so.
So far, Tony, what's coming in is health information and digital divide.
Okay. I'm seeing Kayla's interested in environmental determinants of health, and I see some great stuff coming in related to health misinformation, a couple related to environmental determinants of health. Lisa always votes for data. That's not a surprise, Lisa. Jenny Pierce is also interested in data searching for community-based research centers. Diane mentions data as well. John mentions health misinformation, and Amy Allison is interested in community participatory research. Those are some great things. So mentioning each of those different initiatives and priority areas that you mentioned, what would you like to do related to that? If you were given some funding by the NNLM, and I'm not going to mention like costs or anything, and don't think about costs right now, but if you were given one particular priority area, one particular initiative, what would you like to do as an activity or a program that engages your community? And by community, it could be like within your organization, within your institution, or within the greater community. So around your whole city, or even within the community of, say, librarians or a community of researchers. Think about that. Beth mentions an approach would be a train-the-trainer model where librarians can learn how to reach out to and teach community educators on how to find quality information. I think that would be a wonderful activity. And if that would actually be really good for rural health education as well, or telehealth, if we want to think about that too. Bradley mentions working with local literacy council on developing health misinformation programming. Mickey mentions environmental determinants of health and community participatory research as topic areas. Kayla would survey different areas of the community to ask what their biggest environmental concerns are for their area. That is a great first step in determining what it is that you can do for your community as well. It's just talking to community leaders or people within the community to gauge what is relevant and of interest to them first. Jenny mentions teaching nonprofits how to find data for grant writing. That is always important. Tracy talks about surveying for librarians' roles in IRB, outreach and mentorship on being involved with IRBs, not as researchers, but members, support staff. And Michael mentions exploring skill building around health misinformation and making it fun and engaging. That is always a nice segue into gamification related to health misinformation as well. Let's see. Kathy mentions trusted sources, Train the Trainer, and Literacy Council. So Mickey mentions being a little late, but those were the topic areas that called me to being a librarian in a rural area, loving all of these specific ideas. So, I mean, I think it's fantastic that people are sharing these ideas, because hopefully maybe you might say, oh, I'm interested in, say, pollution, gardening, and healthy eating. And there might be others within our region that you can connect with as well, who have those similar interests and can develop replicable programs, not just within your area, but in their area as well. So that's something that would be fantastic that could be done. Jackson mentions a weekly podcast with health professionals and community members on health misinformation. John mentions to teach how to determine and isolate health misinformation from fact and literacy training. And Jenny mentions helping researchers to bring their research back to the community where the research was done. Hopefully, Jenny, you attended the NNLM symposium we hosted just earlier last month on community engagement and research. There were a lot of great presentations that were hosted during that virtual symposium. If you did miss that symposium, all of the webinars are now available on the NNLM YouTube channel. So I'd be happy to share a link to that as well. Fred mentioned supporting open source software to assist other small libraries automate their collections. Also important too. Let's see, let's move on. And I wanted to share some of the highlights of what was done over the past year. Within the NNLM Region 1, we had a lot of change happen, but I do want to mention that, some of the highlights of our activities include funding 19 different projects. And it was roughly close to $250,000 that we were awarded across the whole region. We also hosted several town halls, and we've done a lot of consultations. I think our office had 235 consultations in the past year. And it's to help with different programming ideas, funded projects, all of those things occurred. And then with our webinars and other workshops that we've hosted, we've had over 1,400 participants in attendance. We've also collaborated cross-regionally with other NNLM RMLs, regional medical libraries, offices, and centers on a number of different projects. I mentioned the virtual symposium that we hosted, Advancing Engagement Through Research, and I will try and find the link to that series of webinars and share that with everyone. We also hosted LIS students from the University of Kentucky to get them engaged and interested in some of the areas within health sciences. It was not strictly within the NNLM actually, but there were students that were doing virtual projects across the region. And we've hosted 7 of them this year, and we hope that we can do some more. Additionally, another opportunity that I'll talk a little bit more is we've worked and collaborated with the other NNLM regional medical libraries so that we can provide and pay for those MLA specializations. So if you're interested in getting your consumer health information specialization, disaster information specialization, or data science specialization currently, we can pay that for you so that you don't have to pay the $50 or $75 fee. I know that MLA is working on a systematic review specialization. It should be launching sometime soon. And once that's available, we will probably work collaboratively to see about supporting that program for people as well. And I hope that we will offer additional programming down the road. If you're interested, please check out more. Oh, thank you, Christine, for sharing that link. And we'll be happy to let you catch up with all of those sessions then. And then Bradley asks, could the LIS programs be opened up to other MLS schools within the region? The answer is yes. So if you know of an LIS program that would be interested in support, like similar to the alternative spring break or even a full semester of projects, we can see about that and see if there's a way that we can help remunerate them for the work that they're doing at, say, your own institution or at a hospital library if they're interested in hospital librarianship, for instance. We want to make sure that we can give them some opportunities so that they can build their CVs and find jobs in health sciences down the road. In addition, we have been working on our Region 1 governance program. So I've provided a link for the whole governance program, but initially last year we talked and launched something called the Senators Program, and it became a little bit more confusing based on how other regional medical libraries were referring to them as. So what we've decided to refer as our ambassadors. So the ambassadors are, there's one or two within each state, and what they'll be able to do is teach a few classes that will be available. The first one is an introduction to Medline Plus, and another one would be related to health information or health misinformation and utilizing tools that can help people identifying health in the news and identifying fact from fiction within those as well. We also have a library advisory board and then communities of interest leaders. And I know that there are people on this call right now who are serving on one of those roles. I know that you've been interested, but it's been very hectic as we've been trying to hire, recruit, and have our new staff join us. So please be on the lookout for emails and things about meetings later this May about that. But if you're interested in the governance program, please check the link as there will be a lot more information included there. And there's more information down the road. Looking ahead into year 2, we have several projects that are currently in the works, including we will have library carpentry workshops scheduled both in June and in November. And actually, Christine Neiman, who is our data management librarian, has established and set up the June sessions for the library carpentry workshops. So if you'd like to register for that, please go ahead and do so right away. The class limitation, I believe, is 20 persons for that because there's so many hands-on activities and things that the instructors will be involved in. Additionally, there are a couple of resource guides that are in development from Region 1, including an environmental health, environmental justice resource guide. And then there's one that what we're going to do is create an outreach and engagement guide. And it's not to like create something from brand new. It's to take all of the different white papers that have been identified. It's also other things related to oh, I'm sorry. A question came in about what does library carpentry workshops cover? It covers practical application skills to certain data tools that are available, like R, GitHub, OpenRefine, I think. Christine, can you share the link to that so that people can see what those sessions are that will be covered in the upcoming one? She'll try and find that for you, John, so you can see the specific tools that will be covered. And if you don't get that, please let me know, John, and I'll try and find it. Oh, she's found it for you. So please visit that. And if you are interested or know someone who's interested in building their data skills, they can certainly attend those 2-day workshops. You do have to commit to both days, and we'll actually provide, I think, 14 MLA CE credits for your participation for both days. We are also working to develop a brand new class called an Introduction to Environmental Health and Justice Tools. So hopefully that'll be announced soon. Additionally, we will have some more webinars related to disaster response and emergency preparedness. We hope to include some more webinars on environmental justice, social justice, and health equity. I know that Faith and Nancy are working on a new communications program so that we can be more visible and provide more information to you readily. And we are working collaboratively with all NNLM regional medical libraries, offices, and centers for another symposia that we hope to have available next spring. I think there may actually be more than one symposia next year, so be on the lookout for maybe one in the fall and one in the spring. So more information will be coming. So I've shared some ideas that we were thinking about as we looked at some of the activities, the initiatives, the priorities from NLM, and I shared some of those with you. Are there other activities and projects you would like to see us try and work on and do? And another question might be related to those national initiatives and priorities. What groups or organizations, possibly institutions, should we consider collaborating with to help with these particular initiatives? I am open to all ideas, and just as an FYI, I'll save the chat later so that I can refer back to it in case I am uncertain about things. I will say that, for instance, for community participatory medicine, I've thought about the Society of Participatory Medicine would be great, and I reached out to the board there. Yes, public libraries can certainly help out with promoting and doing things related to these activities. Literacy councils. I think the Pennsylvania Literacy Council has reached out to me, and I think the New Jersey State Library has talked to me as well about some of the literacy activities that they're working on too. And I think I'm on a panel next month for addressing and discussing the digital divide and digital literacy specifically. I'll let you think about this, and please feel free to share some more ideas. Mobile health clinics, those are definitely of interest of mine. There's actually an organization, if you're not familiar with them, called Remote Area Medical Corps. And what RAMCorps does is they set up pop-up clinics through in areas that have significant need for medical exams, eye exams, dental exams, and they provide that for free in the community. And in one weekend, they can see thousands of people. And also what they do is they might set up a pop-up tent where there might be a library who provides health information on the spot. Climate change activists and academics for intersections with health disparities, social determinants of health, or disaster medicine. Those are good ideas, Tracy. Medical librarian activism, tangible steps we can take to protect trans, BIPOC, queer, neurodivergent, disabled, very old and very young, etc. people. That's important. Training suggestion, a lot of our IMGs, some to us with absolutely no Medline training. How about a very basic introduction to Medline aimed specifically at residents? I'm assuming you mean Medline/PubMed versus Medline Plus, Fred. Yes, okay. There are a lot of trainings that are available actually that are very entry level that are actually on the Medline, not Medline, on the PubMed website that you can get to. I'm happy to share the link to that later if you'd like, Fred, because all of those PowerPoints and presentations can be adapted for your use that you see beneficial for your residents at your hospital. Let's move on. So, oh, thanks, Helen. Chambers of Commerce. Well, that's something I need to think about as well. Thank you, Helen. So one of the things that I always like to remind people is if your organization or institution is not a member of NNLM, I encourage you to apply because it is absolutely free and it can give you a nice network of people that you can connect with. They're not just academic libraries, health science libraries, or public libraries, even hospital libraries, but there are special libraries that are also a part of this. Information centers, community-based organizations, faith-based organizations, nonprofits are also involved. Different health clinics are also members as well. And it might help expand your network a little bit and help increase the possible collaborations of different projects and activities that you have in mind too. There are some changes to the Region 1 Awards program that I want to make sure people are aware of. If you have not heard about an application you may have submitted for Year 2 projects, please be patient because all of the applications that we would like to fund, we are going to have go through IRB review, just to make sure that if there is a HSR exemption status that can be assigned to your project, we will do that and cover it for you so that you don't have to worry about going through the process with your IRB. Or if it's a community-based organization or faith-based organization, they don't have to pay for that service at all. So it does take a little bit of time, but we hope to make those announcements for our sub-awardees as soon as possible, but we ask everyone to be patient with Year 2 projects. For Year 3 projects, I want to let everyone know that we will hope to do a call for award applications late this summer. I know that there's a lot of people who are trying to do some of that or thinking about projects that they want to do now, but I also want to have people think about projects starting May of 2023. And we can hold some office hours or consults about project ideas, but my goal is to announce a call for projects later this summer for Year 3. And please be aware that instead of like $20,000 awards or $25,000 awards, we will actually increase the amount to about $49,000 or $50,000. So please be aware that, you know, we'll have less awards, but they should make more significant impact on the region and have a lot more benefit to everyone who is interested in applying. So please note that there will be larger dollar amounts, but the call for that will start much earlier. John asked where to find information about award projects. Please see the link that Faith has shared in the chat box, and that's also listed on the website as well. And if you download any of the handouts I shared earlier, that will be available on the handouts too. As a NNLM member, you are also able to request a number of free informational resources for your library. And these are newly developed, I think, as of last year, actually. And you can have these available in the classes that you offer. You can have them available at your library so users can pick them up. They are much larger than a bookmark size, but they can be used for a bookmark too if you're that interested. So these are the current ones that I believe are current. Can the resources be customized? I don't believe they can be customized. Unfortunately, but I'm more than happy to share the resources with you first if you want to look at that and see if they don't match the sizing needs that would work for your user base. So please, if you're interested in ordering them, go ahead and do so. And that can help you determine if they do need to be a different size for your user base. I would also encourage everyone to create your own individual account. It's different than a member account, but it can be tied to the organization's account as well. When you join as an individual member or for a personal account, you can participate in all of our educational programming that we provide as well. All of our training opportunities are free, just like going to attend the library carpentry workshop, that is also free as well. If we offer a symposia, that can be available at no cost too. So So please create an individual account because you can take a number of different classes. A lot of the classes will offer MLA CE credit as well. And I want to let you know that all of our educational class material can be downloaded and adapted for your own use. So if there's a topic that you're interested in, you can look through the classes, download the material and adapt them for your own library to develop your own resource or put in your own resource guides even. So I encourage you to take advantage of the resources that are available on our website. We have a number of different classes that are actually happening really soon, some starting next week even. So take a look at our training schedule. You can look as far advanced as you want, but some things happen within the month even. So I encourage you to check out all of the new classes that get added continually through this. As mentioned earlier, we have tried to remove a lot of the barriers for librarians to earn certifications that can help build your resume or your CV. In one such area, we covered the fees for information professionals to earn their MLA specialization in consumer health, data services, disaster information. And these specializations can help those who aren't even necessarily interested in medical librarianship. Certifications do expire, by the way. So double check if you have an MLA account, if you had a certification, if they expired or not. I think it expires after a few years, I think. So just take advantage of this because it does save you significant dollars, if I'm honest with you. Each specialization can cost up to $75 if you are aware of that or not. We've also added another program for LIS schools. So if you are an instructor for an LIS program and you're teaching something related to consumer health, data science, even disaster information, let me know. And if you want, you can, not only are the students taking the class to get their credits for, say, graduating, they can actually earn credits towards their MLA certificate as well at the same time. So there's some things that I do, including I would need to see your the whole syllabus and everything, share that with MLA, and they can grant you that option so that we can get your students some options to get their certificates. We've done that for one class that is consumer health oriented at the University of Kentucky. I don't know all of the LIS programs, what they're specifically offering each semester, but if you are aware and would like to let me know, I'm more than happy to reach out to the instructor even so that they can apply and get some CE credit for their students. Okay. I wanted to share again the NNLM Reading Club. It's designed to help libraries promote health literacy and utilize a lot of the ready-to-use resources that are available. Participants are able to see recommended books by different health topics, download discussion guides and promotion materials, and find health information to gain program ideas. Currently, April's focus is on human genetics as we celebrated National DNA Day on April 25th. I will say that the topic for May is caring for Black mothers. We hope to do the announcement actually today or tomorrow of the books that will be offered. So please be on the lookout for that announcement. So the NNLM has in Region 1, a few social media campaigns that we are trying to launch. And we would love it if you would be able to promote these different topic ideas as well. So the first one that we can mention is promoting health misinformation. So you can create and send us your best meme so that we can also share it. And we'll be using the hashtag, Faith, you can correct me if I'm wrong, health misinfo on Mondays. So be sure to list or tag us if you want to just post it directly. And we'll be happy to share that as well with our people who follow us on social media too. You can promote well-being with environmental determinants of health, sharing locations in your community that promotes increasing health environmental determinants of health, such as green spaces or farmers markets. Katie, you can share it on Twitter because a lot of people have their Facebook accounts locked for public viewing. If you want to use the hashtag Where You At Wednesday, that would be fantastic. And then for bridging the digital divide, one of the things that we're thinking about is sharing different organizations, programs, or news in the area or state that support access to online information or increasing digital literacy. And we were thinking of the hashtag FYI Friday. Did I miss any of that, Faith, with the hashtags and social media?
Nope, you nailed it all. I mean, if their Facebook is unlocked, I guess, or if they want to try to use it on Facebook, they could. So we're not against it, but sure, go ahead.
And if you do not want to share it on your own social media accounts, you are welcome to email it to Faith or I, and we can make sure that we share it and get that out there if that's something you're interested in.
Correct.
Another thing that we have plans to do are different blog features of our organizational member profiles. We want to feature the Region 1 organizational members on the blog. And if you have additional projects or interesting things related to community outreach that you're doing, please let us know. We'd love to share that information out so that others can get some ideas of programming and activities that they can do as well. And if you're interested in writing a guest post for us, please let Faith know. Faith would love to have people contribute to our blog, and that's something that you can add to your CV as a non-peer reviewed publication too, I think. We encourage you to connect with our Region 1 office, and there's multiple ways that you can go ahead and follow along with us. So aside from the web, we do have a Region 1 page available. We have an email that you can utilize to contact us generally. You can also follow us on Facebook, Twitter, and now we joined LinkedIn as of maybe a month or two ago, Faith, I believe.
Yes, about a month ago. We're there. Please follow us. We're just following ourselves right now. So we would love to have more people. I'll drop the link in the chat.
It's also in the handouts that we provided too. We also have a digest that we send out weekly or as weekly as we can. So I encourage you to sign up for our weekly digest as we highlight things not only within the NNLM, but also from the National Library of Medicine and even NIH and HHS if necessary. And we also created our blog. So hopefully you'd be interested in following the blog as well. We have also offered bi-weekly office hours. They are scheduled every other Wednesday at 1 o'clock. And if that time doesn't work with you, you can schedule an individual consultation with me or anyone in our department by sending us an email. So if you let us know what the topic is in that email, we can forward it on to the best person on our team who can meet up with you and talk to you about what it is that you're interested in having a consult in. Oh, thanks. We have 8 LinkedIn followers. That's more than our department, Faith. All right. So you've seen a lot of the things that we've shared and we're doing, but since we have over 60 people in this room right now, one of the things that I'd love to know is how can NNLM Region 1 support you and your organization? I'd love it if you would be more than happy to share that. And I'll go through quickly here. John had asked, will you still send certificates of organizational memberships? I think you're referring to the NNLM member certificates that we've had. Yes, okay. There are a couple of things that we're trying to fix within our customer relationship management system, as it would not print labels for us that we needed so that we can send those out. But we would be happy to send them to people on a one-on-one basis until we can get the system to work properly. So if you need that right away, John, send us an email and we can get that out to your library. Does that help? Great. I mean, we do have the certificates, don't get me wrong. We just haven't been able to send them because of some system glitches that we're trying to get fixed right now. So we intend to get those out to everyone. But are there things that I've shared and things that you would like us to do that I have not mentioned yet? So if you have ideas of how we can support you and your organization, I would love to hear that. Or if there are people that you would love us to offer or to connect with so that they can provide a webinar, that would be wonderful as well. Helen Ann is interested in happy hours for networking. I can certainly set that up. We can see how that goes. Maybe once a month, we can do something like that. Soph is interested in Chasing My Cure, the author of that book. Diane says, when ordering the PubMed tips, you get an error message both for in Spanish and in English. Diane, let me investigate that. That's on the National Library of Medicine server, I believe. But let me double check and see if I can get that link corrected for you, okay? You can also let me know if there are different resource guides that you're interested in. That's we have a section on our website for different resource guides. If there's a topic of interest that we aren't addressing, please let me know. We're happy to see what we can do to support you and your organization too, or even your community. I don't know everyone everywhere, and I don't know all of the individual community needs that are out there too. So if there are specific things that maybe we can do, I would love that. You may have seen that the NNLM has been hosting things related to social justice and health equity. You've seen something related to elder justice that we had hosted earlier as well. So if there are topics of webinar ideas, we'd be more than happy to investigate that. Previously, we hosted things on microaggressions and anti-racism activities that could be done within libraries too. So please feel free to share different ideas. I'd love to hear them and see what we can do to help you, your organization, and your community too. I can stop sharing too, so if people want to talk, they can.
Did you want me then to allow people to unmute themselves? We only have about a few minutes though.
We only have a few minutes?
Well, kind of, it's 1:42. So.
Well, okay, let's go back. We can stop at 1:45, that way people can get some chances to
yes. Right now we're just getting, that's a great idea. And thank you all for participating and listening in today. We appreciate it. You didn't have to take the time to do so.
But I will say thank you to all who are interested in things that are done within the NNLM Region 1. Diane Johnson asked, where are the resource guides? Christine, since you're on the web too, helping share some information, can you share the link to the resource guides page? Oh, I think Diane shared it. Maybe? No, that's the ordering one. But if Christine, can you send that? That would be great. But I will say, if you would like to have a one-on-one consultation with me, please feel free to use my Calendly account. I do try and keep it as up to date as possible so that you'll know my availability. If something doesn't work out with my availability that you see, please send me an email as well. I try to be as available as possible and can make some exceptions like staying late or coming in a little earlier if it helps with your schedule too. And I've certainly done that for a lot of people in the past. Thank you, Christine, for sharing that. So all of our guides are available there. We do intend to go through them annually to make sure they're as up to date as possible and see if they're relevant still too. So there will be some discussions with that too. But it is 1:45. If there are no questions, thank you all for attending. I can give you some time before you go to the 2 o'clock sessions that we have available, where I think you'll be able to meet people from the NNLM training office, the public health coordinating office, and the data science service center as well. So thank you, and have a great day, everyone. And let me stop my sharing from there.
Tony, I'm going to go ahead and press save chat. I just don't know if it saves on my computer or not, but I'm going to do it. And
it'll save on your computer and you can stop recording.
Great.
And when